Hi, it's Dr. Biology here, and this video is on antibiotics and painkillers, and it's part of a series of videos on the unit of infection and response for AQA, GCSE biology and combined science, both higher tier and foundation tier. So firstly, medicines called antibiotics, they help to cure bacterial diseases only, whereas painkillers and other medicines are used to treat the symptoms of disease but do not kill the pathogen. So they might make you feel a bit better by reducing the pain that you're experiencing, but as I said, they don't kill the pathogen. Let's talk about antibiotics first. So this chap here, this is Alexander Fleming, and he was born in 1881, and he famously discovered an antibiotic, and he trained to become a doctor. He served as a captain in the First World War, and he witnessed many soldiers who died from infection wounds from the battlefields, and in fact a large proportion of people died from secondary infections. In 1928 he was researching different medical kind of practices, and he was interested in antiseptics, and he went away on holiday, and on his return he discovered a bacteria destroying mold. He named that penicillin, and it was the first antibiotic discovered at the time. Antibiotics, so what are they? Well, antibiotics kill bacteria without harming the body's cells. Different bacteria will respond to different antibiotics. Antibiotics cannot be used to treat viruses because these reproduce inside cells, and therefore it causes problems trying to kill only the virus and not the body cells. The use of antibiotics has greatly reduced the number of deaths from diseases caused by bacteria. Now, one key problem with antibiotics, though, is something called antibiotic resistance. And the overuse of antibiotics has led to bacteria mutating. So this is a random mutation, and some of them becoming resistant to bacteria. So MRSA is a type of bacteria causing serious wound infections, and it can no longer be treated by the antibiotic methicillin. There are other resistant bacteria, but this is the main one that you might see in an exam question. So let's think about, how does antibiotic resistance come about? Well, firstly, as I said, bacteria can mutate. Sometimes this does cause a change that makes them resistant to an antibiotic. So this is a form of what we call natural selection. Secondly, if you have an infection, some of the bacteria might be resistant to that antibiotic, as you can see in the diagram, and therefore they will survive, and therefore some bacteria survive and they reproduce, and therefore the resistant strains multiply and thrive. Okay, so here we've got a little animation, a poor animation, I agree, but this gives you the general idea. So here's a natural population of bacteria. And there are some that are susceptible and some that are resistant. So the resistant ones are the scary ones with the fangs. So what will happen is you start taking an antibiotic. So the antibiotic is exposed to all of the bacteria, and the susceptible weak bacteria will start to die first. So you can see them starting to die. And then you keep taking the antibiotic and more bacteria will die, until eventually only the resistant bacteria are left. So you then stop taking the antibiotic because you no longer maybe feel ill, and leaving the resistant bacteria surviving. So they start to then reproduce because there's nothing to stop them reproducing. And as you can see, their numbers increase, and now there's lots of resistant bacteria. So if you take an antibiotic again, what will happen? Well, let's have a look. So nothing. All the bacteria are now resistant to that one antibiotic. So let's think about, well, what are the problems with antibiotic resistance? Okay, so first of all, we need to evaluate the problem. We need to work out why has it become a problem and how you can reduce antibiotic resistance. Now again, in exam questions, they're more than likely will give you lots of information and lots of data, and I'll be showing you some exam questions in a bit. So why has it become a problem? Well, basically the inappropriate use of antibiotics in the past has meant that some bacteria were able to infect and grow. Some antibiotics have been overprescribed, but they don't treat the bacterial infections, and they've been given out by medical professionals for the wrong reasons. That was in the past. Infections have increased in places like hospitals because they will work really well, because all the non-resistant bacteria are getting killed by lots of medicines, leaving the resistant bacteria to thrive. There are fewer new antibiotics being developed, and that makes it harder to treat the infections. And also, some people don't always finish the whole course of antibiotics. So if you don't finish the whole course, you're leaving bacteria that could possibly randomly mutate and produce resistant bacteria. So how do we reduce antibiotic resistance? Well, you can reduce the amount of antibiotics being subscribed in the first place. You could do rigorous cleaning of equipment and therefore rigorous cleaning of hands of doctors, patients and visitors to hospitals. You've probably seen that if you've visited a hospital. You could maybe isolate patients with MRSA to stop the resistant bacteria from spreading. And also patients should be encouraged to completely finish the full course of antibiotics. So all the bacteria are killed and none can mutate. Let's just briefly talk about painkillers. So these drugs to relieve pain, they don't tackle the cause of the disease, they don't kill the pathogens, but they just reduce the symptoms. So people might be feeling ill, but they feel a bit better if they take a painkiller. Okay, so this gets on to our question checkpoints. If you've seen these types of videos before, you'll know what I expect you to do, but if you haven't, what I expect you to do is to pause it, read it and answer it, okay? And then I will go through the answers with you. I've got a variety of questions, some foundation, some higher tier. Okay, so here's the first question. So I'd like you to pause, read and answer in 3, 2, 1. So question 1, bacteria and viruses can reproduce quickly inside the body and make people feel ill. So it says use the correct answer from the box to complete the sentence. So bacteria and viruses make us feel ill because they produce toxins. Antibiotics can be used to treat some infections. Use the correct answer from the box to complete the sentence. So antibiotics are medicines that kill bacteria. New strains of pathogens have developed which are resistant to antibiotics. Use the correct answer from the box to complete the sentence. So new strains are produced when pathogens mutate. And then it says, what will scientists have to develop to kill these new resistant strains? So for 1 mark, they're going to have to produce new or different antibiotics. Okay, question 2. So again, I'd like you to pause, read and answer in 3, 2, 1. Right, question 2. So we've got some data here, and this data shows the change in resistance to the antibiotic penicillin in one species of bacteria. So a doctor was asked to treat a patient who had a sore throat. And it says, how does penicillin help to treat infection? Well, what it does, it kills or destroys bacteria. The next question says, use the data in the table to suggest why the doctor should not prescribe penicillin. And again, use the data. So for 2 marks, you've got to say why they shouldn't. Well, any 2 from the fact that bacteria may be resistant, or bacteria would not be killed, or they may select a resistant type of bacteria, or it may cause an increased resistance, or the sore throat could even be due to a virus, so the penicillin wouldn't work. Okay, next question. So again, I'd like you to pause, read and answer. So in 3, 2, 1. So question 3, antibiotics are used to treat bacterial infections but not viral infections. So here it wants you to explain why antibiotics are not effective against viral infections. So this is getting a bit more involved, this question. So very basically, viruses reproduce inside cells. Therefore, the drugs cannot reach the virus. So that's what it's looking for in that answer. It then talks about new strains of bacteria have developed that are resistant to antibiotics. There is no effective treatment against them. What must be done to make sure we will be able to treat bacterial infections in the future? So they're testing your knowledge of what we need to reduce resistance. And you can have any two of these. So develop new antibiotics or not prescribe them for viral infections. Or you could say people need to complete the full course of antibiotics, or they should not be prescribed in the first place. Okay, this question, it looks very involved. It's not as involved as you think it is once you get to read it. And this question is about painkillers. So again, I'd like you to pause, read and answer, and it's 10 marks. Okay, so this will take you at least 5 minutes to do. Okay. Right, so the first question, painkillers do not cure infectious diseases. Why don't they? Well, basically they don't kill pathogens. That's all you need to say. And then it gives you some data. So it says the scientists compared drug X with two other pain-killing drugs, drug A and drug B. And then they give you information about that. And then they say over the next 7 hours, the volunteers recorded how much pain they felt. To get valid results, the 3 groups of volunteers should be matched for as many factors as possible. And it says suggest 2 of the factors that should be matched. Okay, so this is testing your ideas of working scientifically. So any 2 from things like age group, your gender, the type of illness that they're looking at, the mass of the person, or if they have other medical issues, and even ethnicity. Okay, so CI, so how much pain did the volunteers still feel 4 hours after drug A? So let's have a look. So I'm just going to draw on here. So after 4 hours, we'll go to drug A, and it says mean decrease of mean percentage decrease in pain. It says how much pain did the volunteers still feel? So it's 100 minus 25. So that will give us, I'll just get rid of the pen. So that will give us 75%. Because even though it said 25, that was the decrease in pain. And it wants you to say, well, how much pain did they still feel? So that's a 100 minus 25 to get that answer. It then says give 1 advantage of taking drug A and not drug B. Well, quite simply, you get faster pain relief, or it's working quicker than drug B. Then it says give 2 advantages of taking drug B. Well, basically you get a decrease of pain is higher, so you're getting the mean percentage of decrease in pain is higher, and the decrease of pain is longer lasting than A. You could maybe mention some of the data in that answer. And then it says drug X is more expensive than A and B, and a pharmacist advised a customer that it would just be as good to take drugs A and B together rather than X. Do you agree with the pharmacist's advice? Give reasons for your answer. Okay, so any 3 from, you could say yes or no basically, but if you said yes, you would say, well, there's rapid pain relief. Okay, it's longer lasting pain relief, and it costs less if you use drug A and drug B. Whereas you could say no, because drug X gives the most pain relief, and it also, if you took both A and B, could result in an overdose, or you could have more side effects from taking the 2 drugs. Okay, question 4. So I'd like you to pause, read and answer in 3, 2, 1. Question 4. So pathogenic bacteria and viruses may make us feel ill if they enter our bodies. Why do bacteria and viruses make us feel ill? Well, that should be through your knowledge that bacteria produce toxins, whereas viruses, they damage and kill cells. Then says most drugs that kill bacteria cannot be used to treat viral infections. Explain why. So you need to understand the difference between bacteria and viruses. So any two from the viruses live inside cells, so the drugs cannot get to them. And if the drugs were going to kill the viruses, they would damage those body cells. Then talks about antibiotic resistant strains of bacteria are causing problems. Explain as fully as you can why there's been a large increase in the number of antibiotic resistant strains of bacteria. Now this is 4 marks, so you're going to have to really give lots of information in this kind of answer. So any 4 from the following. So firstly, there's an overuse of antibiotics. Secondly, bacteria may mutate, particularly if people don't complete their course. Antibiotics do kill non-resistant strains, and what that does is actually reduce competition, so the resistant bacteria can reproduce and you get large numbers. So if you just remember, the animation that I showed you was showing that kind of lack of competition, so the resistant strain could basically take over. Okay, so that brings us to the end of this topic. Please do subscribe, put on your bell alert reminders, and I'll see you soon.